under the age of 5 should die from preventable disease, and all our children deserve the long-term good health. The government of South Africa has declared the first Saturday of November, that is the 7th, as the National Children's Day. The aim of National Children's Day celebration is to highlight progress being made towards realization and promotion of rights of children. So today we focus on child health. We will, with the help of our expert guests, examine the state of child health today and learn more about how children's rights and the Sustainable Development Goals impact on their health. We will also discuss a disturbing trend of possible overdiagnosis of ADHD in children and the abuse of ADHD medication. Interact with us on our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk. Sit back, relax, and learn from this exciting show ahead. I'm Dr. Sello Mutau, and this is Health Talk.
Children represent the future, and ensuring their health and development ought to be the prime concern of all societies. 9.7 million of children under the age of 5 die every year of mainly preventable causes. HIV and AIDS-related diseases are still a major cause of death in young children, followed by pneumonia and acute diarrhea. Malnutrition is also a major contributing factor to child death. 1 in 4 children is stunted, and many are deficient in vitamins and minerals essential in preventing disease and disability. What rights does a child have?
So South Africa is a party to the United Nations Convention on the Rights of the Child, which states that a child has the right to the highest attainable standard of living. Our own constitution confers the right to an environment that's not harmful to his or her health, and for children specifically, it confers the right to adequate nutrition and basic healthcare services. I think that is quite important for people to understand.
Section 28 of the Constitution is devoted to children and outlines their rights.
Although there are efforts to ameliorate their plight, the situation for many children remains dire. As far as child health is concerned, challenges that exist are a lack of education, as well as aspects such as challenges in the healthcare system with regard to finances, infrastructure, and resources. Also, in South Africa, there's a large amount of inequity. That is a vast distinction between children living in affluence and those in poverty, and this is reflected in the child's state of health.
A study conducted by Human Sciences Research Council reveals that poor quality healthcare, low immunization rates, and misguided infant feeding practices also contribute to poor health in pregnant women and children.
During pregnancy, ensure that no drugs are taken, that there's no smoking and no drinking, that parents ensure that they are as informed as possible surrounding child health, that positive habits are practiced in order to ensure that the child's environment is clean and healthy, then aspects such as immunization and ensuring that the child is taken to a healthcare facility when or if the child becomes ill.
Of great concern are the high death rates of newborn babies. Almost 40% of all under 5 deaths occur in the first 28 days of life, according to UNICEF.
Infant mortality rate, under 5 mortality rate remain high, and maternal health remains a continuing issue. Many children live far away from a healthcare facility, and many children suffer from child hunger and malnutrition, which leads to stunting and impairment of development.
It's important that as a society we ensure that children's rights are protected. Even at the global level, at least 4 of the new Sustainable Development Goals relate to child health.
So the South African government is committed to the protection of children's rights enshrined in the Constitution. We learn that protection is everybody's responsibility. So to what extent are these rights protected insofar as they relate to child health? Well, let's find out from our special guest. And today we have Professor Peter Cooper, who's head of the Department of Child Health and Pediatrics at Wits University and Charlotte Maxeke Hospital in Johannesburg. Welcome to Health Talk, Prof. Cooper.
Thank you very much, sir.
All right, we're talking about children's rights. I mean, today, being National Children's Day, the emphasis being on children's rights. Can you perhaps just take us through children's rights, just insofar as they relate to health?
Well, all children should have access to adequate health care,
Right.
not only curative but preventative as well. So that includes immunizations,
Right.
adequate nutrition, etc.
Okay. Now, we learned that in the past, we spoke about Millennium Development Goals,
Yes.
and that has come and gone, as it were. We now have the Sustainable Development Goals. Insofar as, firstly, maybe let's just track back to the MDGs and talk to those ones that refer to child health, and then move over to the SDGs. Your comment on that?
All right, so the Millennium Development Goals were actually signed by all member countries of the United Nations in 2000, 2001.
Yeah.
But as far as children's goals were concerned, the main one was that under 5 mortality, children under the age of 5, the deaths in that age group should be reduced by 2/3, using 1990 as the baseline figure, and now 2015 was the target year. So that was the main goal. The others were to alleviate poverty and attack infectious diseases such as TB, AIDS, HIV, etc.
Okay. And then we learned that there's about 17, SDGs
Yes.
now. Yeah.
So what has happened now is that whereas the Millennium Development Goals were fairly focused on a relatively defined area, Sustainable Development Goals have now been expanded to look at a whole range of other things, such as the environment, global warming, and poverty in a much broader sense, and so on. But there have been a lot of people working internationally to ensure that particularly maternal and children's health remain on the agenda, and that the goals and the achievements that have been attained during the Millennium Development Goals period will not lose its impetus.
Okay.
And the UN Secretary General has actually taken a personal interest in this.
Yeah. Now, if we look at South Africa, I mean, we seem to have done generally well with the MDGs, except when it comes to, at least 2 of them. Let's just briefly go over the current state of health, of child health rather, in South Africa currently. What do children suffer from in terms of, common illnesses and so on, and what do children die from?
The common illnesses are still infectious diseases, and particularly gastroenteritis, diarrhea, and chest infections, pneumonia. And then there's a large group of conditions related to newborn babies, and that's now become quite a focus nationally and internationally, because if one looks at the achievements of the MDGs, the children between 1 month and 5 years of age, the mortality rates there have declined much more significantly than those in the first month of life. So newborn health is attracting now a much greater focus.
Okay. You talk about infectious diseases. I mean, one of the reasons why we haven't done so well insofar as, some of the MDGs are concerned is the impact of HIV and AIDS. Yeah. Is that still a huge issue in the newborns?
Well, not so much in the newborn. Babies are usually infected in the newborn period, but they tend to present with disease later on. But in terms of prevention of mother-to-child transmission, we've actually done very well in the last 10 years. Up until then, it was a huge problem, but we've reduced the mother-to-child transmission quite dramatically in the last 10 years.
All right. And then what sort of infectious diseases are we talking about? I mean, you mentioned, maybe let's just focus on children under 5, because, that appears to be quite a bit of a problem there. You mentioned diarrheal diseases. What's causing these problems?
Well, it's related to being exposed to infections. And one of the main sources of infection is drinking water and food, contaminated food.
Right.
And that's why the country and the Minister of Health and the health departments of the provinces have been pushing breastfeeding very strongly, because breastfeeding is much safer from the point of view of contamination and infections than children who are either mixed fed, breast and formula fed, or just not breastfed at all.
Yeah. I mean, since the advent of democracy, I mean, obviously as a country, we've come a long way, and there's been talk of, people having access to clean drinking water. Clearly, that may still be a bit of a problem, because you often hear outbreaks of cholera, for instance, in some of the outlying areas. What's your view in terms of, these epidemics, especially that relate to access to, basically contaminated drinking water? Are we doing better as a country? I mean, where are we, if you perhaps look back over the last, say, 10, 15 years?
I think if we go back to, as you said, 10, 15, 20 years, I think many more people have access to clean water. But there's still problems there, particularly in the rural areas. There are many children and many families who don't have access to clean water. And even in areas where they do have access to clean water, there have been problems sometimes with the water supply. So that not only children but adults get ill as well.
Okay. The issue of breastfeeding, I mean, as you mentioned, it's one best way of at least protecting the health of children. Are we doing well in terms of advocating benefits of breastfeeding and so on in this country? Are we having mothers today who just don't breastfeed their kids, or how are we doing generally?
Well, I think we went through a very bad period where the breastfeeding rates in this country were very, very poor. But over the last 5 years or so, certainly there's been a great improvement. I would like to see much more in the way of public campaigns on radio, television, stressing the importance of breastfeeding and encouraging mothers. Because what we would like to see is mothers would breastfeed their babies for 6 months before introducing other foods and other liquids.
Yeah. And then, I mean, obviously relating to breastfeeding, perhaps just tracking back a little bit around pregnancy, because I think it's important what happens to a pregnant mother in that state before the child is born, in terms of now access to antenatal clinics where there's proper health education that's given to the mothers and so on. How are we doing in that regard?
We're doing better. I think one of the first things that the new government after 1994 did was to bring in free healthcare for pregnant women and young children. And that certainly over the years improved the rate of mothers going to antenatal clinics. But we still have a problem there, because what we would like to see is mothers starting to attend antenatal clinics very early on in their pregnancy, preferably within the first 3 months of pregnancy, because then that allows for problems to be picked up, and it allows also for adequate follow-up of the pregnancy. So we're still seeing some mothers who start attending relatively late, or in a relatively small group now, not attending antenatal clinic at all. So there's a lot of room for improvement in that area.
All right. I mean, to round up this discussion on rights of children and health, I mean, do we still see a lot of cases that perhaps might indicate that children's rights aren't protected as we want to?
I think it's, it depends how you define that, I suppose.
Right.
I think we've got quite good health coverage. What's sometimes lacking is the quality of that health care. So that while there's access to clinics and hospitals, sometimes we find that these conditions are not managed as well as they should be, and therefore children may still be disadvantaged because of that. So I think
it's something that we need to avoid, obviously. All right. Please stay with us, because after the break we discuss if ADHD is real or not. Don't go anywhere.
Media Monitor, your weekly media news review program.
It was squashed some few months back, but obviously this is something that is going to hang around Praveen until it is actually dealt with. If he didn't know, then he wasn't doing his job.
In it, she described how the man's hair was frozen, although the man has no hair.
Is anybody volunteering to go to jail for him? That is not how the law works.
This particular matter makes us really look like a serious banana republic.
Unpacking headlines and giving analysis on topical issues. Sundays at 9 a.m. only on the SABC News Channel.
Your destiny is not determined by the township you come from.
The one place we will find movers and shakers is in the township. It's just that they're diamonds in the rough and some of them don't even know it.
Being young with no experience in business is a challenge that Bulelani took upon himself.
I was motivated by the prayer. I was motivated by the love.
To be a novice in business was tough, but experience made him a businessman of note.
It took me 7 years to make my first million. I've got all the scars to prove that I started with nothing.
A journey well traveled.
For me, that is the one major thing. The ability to touch other people's lives. Nothing goes beyond that.
Join your host Puleng Mulebati on Bopilong every Saturday at 5:30 p.m.
Attention deficit hyperactivity disorder is one of the most commonly diagnosed chronic childhood disorders. ADHD prevalence has grown exponentially over the last 20 years, and there are growing concerns that this condition is overdiagnosed. Of greater concern is the simultaneously growing habit of abuse of ADHD medication by school children and adolescents. Varying prevalence rates of ADHD have been reported over the last years and across the world. These range from 1 in 100 to 1 in 5 individuals. Prevalence rates in South Africa are not exactly known, but are estimated to be 4 to 5 in 100 children, with the incidence being greater in boys than in girls. There has been a lot of public agonizing lately about the steep rise in diagnosis of ADHD over the last 2 decades. There is a growing and justifiable worry that a lot of kids are being put on a stimulant medication that they don't really need. Blame has been directed at parents for being so poor at discipline that they reach for a pill to make unruly kids settle down. Teachers are being blamed for being so inept at maintaining order that they want students' medication into submission. Psychiatrists are also blamed for being the pawns of drug companies peddling ADHD medications. South Africa has one of the highest rates for prescribing ADHD medication for children in the world, a rate that is said to be even higher than that of the USA. As more and more prescriptions are being written for medication to treat ADHD, more and more children are abusing these drugs. As a parent, you may never have considered that your child may be abusing prescription medication. But South African students as young as 16 are reported to be snorting and swallowing Ritalin to get high, to the same extent they do with other drugs such as cocaine.
Before getting into a discussion on abuse of ADHD medication, let's understand a little more about ADHD diagnosis from our special guests. First up is Dr. Sihle Sibia, who's a specialist pediatrician based at the Waterfall City Hospital in Johannesburg. Welcome to Health Talk, Dr. Sibia.
Thank you very much.
All right, and next to her we have Mr. Elijah Ace Mayema, who's Director of ADHD South Africa and who's also Chairperson of the ADHD Soweto branch. ADHD South Africa, Soweto branch. Welcome to Health Talk, Mr. Mayema.
Thank you, Doctor.
All right, perhaps let's start with you, Dr. Sibia. ADHD, what is ADHD?
ADHD is a childhood disorder which manifests with the symptoms of hyperactivity, impulsivity, and or inattention.
Okay. We're going to talk a little later about overdiagnosis. But before we get there, How common is ADHD?
It is quite a common disorder in school-going children.
Mm-hmm.
The statistics range to around 7.2%.
Right.
But there's a wide variation depending on whether you're looking at children at a primary care level or at a referral center.
Right.
Obviously, the numbers at a referral center will be much higher, and they go up to 11 or 15%.
Okay.
But on average, it's around 7.2%. It's more common in boys than girls.
Right.
And the hyperactive type is more common than the inattentive type at a ratio of 2:1.
All right. Let's stay on prevalence, or incidents, perhaps, if you may. And let's look back over the last, say, 10, 15, 20 years or so. There's people, lots of people out there who are saying, the prevalence has been rising at an exponential rate. Why is that so, do you think? Or is it true in the first place?
I think it's more perception because we're better equipped to identifying and diagnosing ADHD.
Right.
But the evidence shows that it has remained quite stable for the last 30 or so years at a prevalence of around 7.2%, as I have said.
Mm-hmm. Let's hear from ADHD South Africa. Perhaps your perspective, Mr. Maema. How commonly do you see this condition around in South Africa in general? And I'm going to ask you about Soweto as well.
Well, thank you, Doctor. Very common in that depending on which side you're sitting.
Yeah.
If you're sitting on the side of people who are aware and knowledgeable about ADHD, you'll then realize, like the doctor is saying, seeing the symptoms thereof. But if you're sitting on the other side of people who are not aware and knowledgeable, you just see crazy people moving around. But
well, let's talk about awareness. Are people aware of existence of this condition, ADHD? Let's talk people in Soweto, for instance.
Not much.
Yeah.
Not much. I have been running workshops around Soweto,
yeah,
particularly to teachers who are the people sitting for about 6 to 8 hours a day with learners.
Yeah.
And those are the people who are supposed to pick on the symptoms of these kids who are ADHD, because it's not a once-off observation. It should be a constant looking at, is learner X, Y, and Z exhibiting these signs and symptoms. And it's quite amazing how teachers during question and comments time say, we've been wondering why learner X, Y, and Z are behaving in this particular fashion. Because if you go to school, you find kids are sitting outside, and teacher A, B, and C will tell you this boy is naughty because they are very fond of labeling these kids. They don't have intervention strategies, though they are there, but they don't know.
Okay.
Yeah.
Talk about teachers now, Dr. Sibiya. I mean, this is one other, perhaps if you like, controversial area. That the reason you probably have the prevalence rates, or at least the perception that, it's becoming, in fact, more common than it should be, that more and more teachers are actually diagnosing ADHD. Tell us about how ADHD is diagnosed. What are the typical features of ADHD in children?
So according to the DSM-5, you need, if you're less than 17 years of age, you need 6 or more symptoms of hyperactivity and impulsivity, or 6 or more symptoms of inattention.
Okay.
It also has to be present.
Can you expand a little bit on those main symptoms? By hyperactivity, what exactly do you mean?
It's typically a child that just does not sit still, that fidgets all day, that cannot focus on a task, that is a typically busy child, but it has to be developmentally inappropriate for that age of,
Okay. It's not just a busy boy that's, like you find with all boys that, they tend to jump up and down and over tables and that sort of.
It has to be excessive,
right,
and also inappropriate for that for that setting.
Right.
And it also needs to occur in more than one setting.
Okay.
So it cannot only be something that occurs at home. It must occur maybe, for example, at school and at home,
right,
for us to make the diagnosis that this is ADHD.
Okay, the inattention part now and the role of the teacher in the diagnosis.
The teacher is crucial. The inattention type tends to be missed because these are kids that won't typically be busy and all over the place, but they will find it difficult to focus on a particular task at hand, be overwhelmed with the work that they are given. So they tend to be missed as opposed to the hyperactivity kids. The teacher is crucial in assisting in making the diagnosis. For example, that they can assist in rating the child, in doing a behavioral rating scale, which is used in addition to obviously a clinical examination and a history when the diagnosis of ADHD is involved. A lot of the time, the teachers are the first to pick up the symptoms of inattention just because of the classroom situation where the child is, that's the situation where the child is expected to focus and give attention to work. Whereas on the soccer field, it may not be, those skills are not necessarily required.
Right. Mr. Bama, you know, for a child who has an ADHD child or a child with ADHD, it can be quite a problem. What work do you do with parents?
Just to add on what Dr. was just saying, in terms of diagnosis, the teachers and the parents are very key in that they ask us to pick the symptoms, as I said earlier on, and move on to the next level, where they send kids to therapists, you know, psychologists and all that. And the psychologist will confirm the picking up of symptoms. Then from there, the therapist will then go to the doctors who confirms to say indeed the diagnosis is correct.
Right.
But in terms of the parents with children who have ADHD, they run them crazy. What we do is that during workshops, I give demonstrations to say, these are children. Remember that they don't have a concentration span that is quite long, and they don't want 10 instructions at a time. You do things with them. You give one instruction at a time. You perform that with the child. Because if you say, I'm going to church, please make sure that you remain home and you cook, you clean that. The last word is clean that. Now the child will be saying, by the way, what did mom or dad say in terms of cleaning? So parents have got to be very cautious because they are not experts. Right. What they need to do is to say, have what we call, I usually refer them to the police to say, police use what is called an occurrence book. Just write on daily basis what the child is doing, at what time this child is acting out, because we're more looking at the behavior of kids rather than, it's not like taking blood and taking it to the laboratory.
Yeah. Very, very, very wise words for parents listening out there. Anyway, ever imagined that medication to treat ADHD can be sniffed like cocaine? Well, more on that after the break. Please stay with us.
Are you saying the king must go to jail? You are not royal blood, therefore you are going to serve time on behalf of the king. Where does the public protector stand on this matter? Are you with the marches, for the marches, against the march? If this is your ancestor, it is very much his ancestor as well, because this is the cradle of humankind. Is there God somewhere in your science? Drinking the blood of a person with albinism gives extra magical powers. A man of the cloth is involved here because it would mean that somehow religion is being brought into this part of the myth. What do you say to it?
Watch Question Time with me, Mpho Tsedu, Monday to Thursday at 5:30 p.m. on the SABC News Channel.
In Africa, mobile devices are tools to make payments, browse the internet, and keep governments in check with social media forums.
It's given an average African too much power in their hands.
And tech creativity is solving some of the continent's problems.
Everything is internet driven.
And on Network, we tell you how Africans are using technology and social media in their everyday lives.
Join Siphumelele Zondi on Network every Sunday at 19:30 CAT.
Welcome back to Health Talk. Now, it is reported that at least 60% of all prescriptions for ADHD medications are not being used for the condition and are being distributed in schools and universities for recreational use. Ritalin has been dubbed the rich kid's tick, as it is predominantly being used by kids in private schools. Now, this is not me. This is according to Anti-Drug Alliance, represented today by its CEO, Quinton van Kerken. Quinton, welcome to Health Talk.
Morning, thank you.
Before I get to you, we still have Dr. Sihle Sibia, a specialist pediatrician based at the Waterfall City Hospital in Johannesburg. Dr. Sibia, perhaps before I start with Quinton about these strong statements, or shall we call them allegations, that is made around abuse of ADHD medication. But let's briefly talk about treatment of ADHD. But before that, I need your opinion. In your opinion, is ADHD overdiagnosed? Yes or no? No, okay.
I think it depends where you're looking at it. If we had to stick to the strict DSM-5 criteria, then we're probably not going to be overdiagnosing it.
So you're happy that, generally speaking, all diagnosis is correct and according to the DSM-5 criteria?
No.
Why not?
I think that a lot of kids are referred with symptoms of hyperactivity or inattention, but they don't necessarily fulfill the criteria.
Okay.
So I don't think that every child with inattention or hyperactivity fits the DSM-5 criteria, which means that they, strictly speaking, do not have ADHD.
Interesting. All right. Well, because that now relates to abuse of medication. But before that, let's talk about how ADHD is treated.
So the mainstay of treatment for kids over the age of 6 will be pharmacological treatment, and stimulants are the main drugs that we use for the treatment of ADHD. There are other drugs that are available, but usually the common drugs that we see with Ritalin is the most common drug used. There's also behavioral therapy that's very important.
Let's talk about that, because some people perceive ADHD being a condition that requires medication to shut this child down a bit. Is there other forms of treatment, be they behavioral or the role of nutrition, for instance?
Okay, so behavioral therapy is a very important component of ADHD. It can be done in the school setting and in the home setting. I think in the previous segment, we spoke about ideas of parenting skills and skills for the teacher as well. So, for example, in the classroom, the child needs to sit next to the teacher. Smaller classroom groups are appropriate. Giving the child short tasks and breaking up the task into smaller segments so that he can cope with the work.
Okay.
When it comes to nutrition, a lot of studies have been done to see if there's an association between elimination diets and supplementation. But there's no, and different types of supplementations like omegas, but there's no strong evidence that these do reduce the symptoms of ADHD.
What about sugary drinks and stuff, though?
No, there's no evidence that those contribute to ADHD, although some kids do have adverse reactions and their behavior is slightly worse when they take certain foodstuffs. But the recommendation is that elimination diets and removing stuff from the diet doesn't necessarily work to treat the condition.
Okay. Quinton, you've been quoted as saying ADHD is overdiagnosed. Why do you say that?
I think my colleague actually summed it up, because many doctors will look at the strict criteria for the DSM-5, and exactly what you said. They stick to the criteria. Unfortunately, there's a lot of children that just sometimes, and you also quoted it quite nicely, have an adverse reaction to some food types. Sugar being one of them. Give a child too much sugar, he's going to bounce around a little bit. And that's not ADHD. That's just too much sugar. I think on the other side of things, I really do think we need to look at kids' diets. There's way too much refined sugar in their diets these days. And yes, I think there's a contributing factor there, but also hopelessly overdiagnosed, because a lot of parents as well just don't have the time or the inclination to actually spend the time with their children.
All right, let's get back now to your statements around Ritalin and other medication being abused. You go as far as saying some of it is sniffed by these kids.
Yeah, look, we've done a lot of research. As you know, in the past, ADA has done a lot of research surrounding this. We found that there's syndicates in schools, if I can call it that, where they will get a lot of Ritalin. They'll then sell it to the other kids as a recreational drug. We have found that many drug addicts that in the absence of cocaine, for instance, will actually take Ritalin or Concerta, crush it up and snort it, same effect to them.
Because I was going to ask you, does it give them the same effect as cocaine and other amphetamines?
Yeah. Where what is very interesting, what we found is that there was a little bit of I'd almost like to say, research that we did where we managed to get hold of some crack cocaine from the streets, and we found that it actually had no cocaine in whatsoever. They were literally making crack using bicarb and Ritalin. The only difference that the addicts could tell us was that the one made with the pills actually tasted a bit burnt, plasticky in their mouth. It had exactly the same effect on them as the crack cocaine. So yes, there's a lot of abuse of it happening. We find that students will use it to study because it apparently focuses them. We'll find that a lot of people will use it recreationally just to relax, or if slight overdose actually gives them a very stimulant effect, and they enjoy that as well. I've heard of adults drinking the pill, a couple of their kids' pills, so that they can go out and out on drinking and not get too drunk.
This is worrying, Dr. Sabia. I see you shocked. First of all, I mean, it's worrying that kids get hold of Ritalin, which is supposed to be a Schedule 6 prescription drug. We don't know how that is possible. But perhaps let's talk about the dangers that, this can have, perhaps from a point of view of inappropriate use of Ritalin. I mean, the possible side effects of overdosing, for instance.
Obviously, Ritalin is a stimulant. So it does give you those euphoria effects. But the serious side effects would be psychiatric side effects, so suicidal ideation, hallucinations, delirium, all the way to sudden cardiac death. So it is quite a serious substance to take recreationally. I think, as Quinton said, that the availability of it is literally from kids it's prescribed for them, and then they pass it on to their friends at school, or they sell it on to other clients. That's the only way that it could be so available.
Right. And the role of medical professionals in this regard, I mean, it's a common thing you hear all the time, especially around this time. University students, high school students, kind of demanding scripts for Concerta because it helps them concentrate and help them study.
Yeah. So I think that the medical professionals need to be quite vigilant when they prescribe Ritalin, and also discussing it with their patients that need it for their ADHD, that they should not pass it on, and also discuss the dangers of passing on the medication to people who are not necessarily diagnosed with this disorder. And I think earlier on in school-going age, start talking about that your medication is yours and do not pass it on to other people. Also, the parents can get involved by doing a pill count, making sure that the number of tablets correlates with the dosage that the child has been given. From what I've read, it seems that the short-acting Ritalin is more abused than the longer-acting Ritalin like Concerta, just because the effects are more immediate than the longer-acting formulation.
I wish we had more time to tackle this, but unfortunately we've run out of time. So how can we improve child health? That and more after the break. Please stay with us.
For victory requires intense effort and teamwork. When you get to it, there is no turning back. Because all eyes are on you. When it's action time, nothing should stand in your way. Sports Live tackles and analyzes all the sport action. This is the home of all your sport news, updates and more. Sports Live weekdays at 8:30 p.m.
Welcome back once more. So how can we improve on the state of child health in South Africa? Now let's get some tips on how this can be achieved from our special guest. Back with us is Professor Peter Cooper, Head of the Department of Pediatrics and Child Health at Wits University and Charlotte Maxeke Hospital in Johannesburg. Prof. Cooper, I mean, we've had disturbing stories. Obviously, when we started, our discussion, it was around looking at the state of health, the problems around child health, insofar as, rights of children not being protected. And of course, we had disturbing stories around ADHD, and of course, it relates to child health broadly. But let's talk about how we can improve the state of child health in South Africa. Perhaps let's try and be methodical, as it were. Let's start around pregnancy. I mean, some of them we touched on a little bit, but just to recap, what are those things that need to be done at pregnancy stage to ensure that we have better health outcomes for children?
Okay, well, I think, as we mentioned, antenatal care is crucial, and antenatal care should start early on in pregnancy during the first trimester. Mothers will have various tests done to make sure that they don't have any infectious diseases that could be passed on to the baby. And also blood group and so on. So there are various tests that should be done. They're simple tests, but they're very important in terms of having them done.
Yeah. Perhaps even before pregnancy, we should have said, that it's important for women to have access to family planning services, so that they're able to space the pregnancies.
One would hope that as many pregnancies as possible are planned.
That's right.
And then the mother and the father hopefully are ready for the pregnancy and prepared to take it on. And when the baby becomes, when the fetus becomes a baby, obviously the care is going to be provided.
And of course the health of the mother is important. I mean, there's a saying that a healthy mother will mean a healthy baby and a healthy nation. Now, in terms of young children, let's get back to and re-emphasize. I know we spoke about it, but re-emphasize that issue around breastfeeding.
All right. Well, I think what is becoming a very strong focus now is nutrition and adequate nutrition. We mentioned infectious diseases such as gastroenteritis and pneumonia being common causes of childhood deaths. But in fact, underlying that is malnutrition. And children who develop a chest infection and get pneumonia, who are well nourished, are far more likely to be successfully treated than if they're malnourished. So it's in fact estimated that a large proportion of these young childhood deaths, although you can say it's due to gastroenteritis or pneumonia, one of the underlying causes is malnutrition. So breastfeeding for the first 6 months of life is absolutely crucial. It's been shown that wherever you go, wherever babies are in the world, their growth patterns, if they're breastfed, are pretty similar, whether you're in Asia, Africa, America. So that's something that we really need to get right, and we're improving, but we haven't got right yet.
I mean, the other issue relating to nutrition in children is the whole notion of childhood obesity. That, I mean, obviously we're seeing trends that this is something that's getting worse over time. Your comment on that?
Yeah, I think this is, people are talking about the double burden of malnutrition. So we're looking at young infants who are undernourished. But then as they get older and they're subject to inadequate diets, and particularly, I think was mentioned before, high sugar content in the diet, childhood obesity is becoming much more common, which in turn leads in many cases to obesity in adulthood. And we mentioned earlier the Sustainable Development Goals, and one of those, the focus of one of those is in fact looking at non-communicable diseases in later adult life, such as diabetes, hypertension, heart diseases, stroke, etc. And a lot of that is due to, or is precipitated or predisposed to, by inadequate diet early on in childhood and early adult life.
So the issue to watch there is obviously the highly processed foods and sugary stuff. And, incidentally, there was a study released recently by Harvard University, by the way, that much as we're talking about malnutrition and obesity, stunting, by the way, is still a problem that we need to be aware of.
Yes. And stunting is also, we've seen some decline in this country in the rates of stunting.
Yeah.
But again, stunting has been very closely linked with intellectual performance later on. So children who are stunted early on tend to be not to achieve as well academically, school-wise, and later on. And obviously then that reduces their ability in terms of earning capacity as adults. So, and stunting is really related to malnutrition starting from early conception.
Right.
So we talk about the first 1,000 days, but that's the 9 months of pregnancy and the first 2 years of life.
Okay, all right. Let's talk a bit about vaccination. I mean, the importance of vaccination. You know, parents out there watching. What is their responsibility when it comes to vaccinations?
Well, I think that's absolutely crucial. We have an excellent immunization program in this country. In 2008, we introduced vaccines against one form of pneumonia and one form of gastroenteritis, and that's had quite a significant impact on the children's health. But it's dependent on the child getting immunized. And we've seen in the past outbreaks of measles, for example, and that relates purely to the fact that you've got a pool of children and sometimes even adults who are unimmunized or inadequately immunized, and then the disease can take a hold in a community. So it's absolutely crucial that children and babies and children are immunized according to the schedule that we have.
Right. I mean, there's been newspaper reports around shortages of vaccines, but I mean, the Department of Health basically, put it to poor distribution. And the important thing being that if you go to a health facility and they say the vaccine isn't available today, and you're told to come back on a specific date, please do come back, because it's important to again get the vaccine for the child. Now, a lot of parents watching this show would want to get tips on how to spot that the child is in danger. So as a parent, the child has diarrhea, for instance. What are those things that parents should look out for that will say to them, this is time now for you to go and seek help from a health professional?
Well, I think to mention diarrhea, that would be one.
Yeah.
Particularly if the child is having frequent passage of loose stools. Obviously, the clinics will teach mothers what they can do even before they get to the clinic in terms of making up salt and sugar solutions. But in general, I think any child with significant diarrhea should seek medical attention.
Right.
The other one we mentioned is chest infections, and that would usually manifest with the child breathing faster or having noisy breathing.
Right.
So those would be the obvious ones. But
how do parents handle a child that's got a fever, that's hot?
Well, I think fevers are very common. On their own, there are over-the-counter medications that can be bought, and paracetamol is a common one used.
Yeah.
But if it's a very high temperature, particularly in a young child, then that child should be seen at a health facility.
Yeah. Well, Professor Cooper, unfortunately that's all we have time for. Thank you very much for your contribution.
Thank you.
All right. Now, folks, let us sacrifice our today so that our children can have a better tomorrow. Let us all hold hands and ensure that all our children live in a safe, healthy environment, free of disease, injury, unhealthy behavior such as drug and substance abuse. It is on that note, unfortunately, that we'll come to the end of our show today. Join us again next week on SABC News. A reminder to please share your views and comments with us via our Facebook page, SABC Health Talk, and follow us on Twitter at SABC Health Talk. And of course, you can watch repeats of this show at 2 p.m. today and at Tuesday, 5 a.m. Or simply go to the SABC YouTube link to get all our previous shows. I'm Dr. Silom Down. Thank you for watching, and please do take care.